All right, today we're going to demystify one of the most incredible pieces of medical technology out there. We're taking a journey deep inside the human body without making a single incision to understand magnetic resonance imaging, or what most of us just call an MRI.
So, why is this thing such a huge deal? Well, to really get it, we've got to start with a really simple but fundamental question. Yeah, just think about that. For so long, the main way to see inside someone was with X-rays, right? And that means radiation. But then MRI came along and offered a totally different way to do it. A path to getting these unbelievably clear pictures of our insides and doing it safely. And that right there, that's the key difference. Look, X-rays and CT scans, they're amazing tools for sure, but they rely on ionizing radiation. MRI, though, is in a whole different league. It uses a super powerful magnet and radio waves. Zero radiation. None.
Okay, so what is it exactly? Magnetic resonance imaging. The name kind of gives it away, right? It all starts with this massive magnetic field that lines up all the tiny little protons in the water molecules in your body. Then it zaps them with some radio waves, which makes them send out signals. A really smart computer listens to those signals and turns them into those super detailed pictures that doctors need.
So when would a doctor say, yep, you need an MRI? Well, for one thing, its ability to show soft tissues. We're talking brain, muscles, ligaments, all that stuff. It's just second to none. And because it works so differently, it can catch things that other scans might totally miss. That's why it's such a go-to tool for, say, brain or spine specialists.
But here's the thing, looking at an MRI scan isn't like just looking at a photo from your phone. It's more complex. To really get what's going on, you kind of have to learn to speak its language.
And a really great way to think about this is that an MRI isn't just one single picture. Nope, it's more like a whole set of different camera lenses. The technician can switch between these lenses to highlight specific things. So one lens might make all the water in your body pop, while another makes fat stand out. It's all about bringing the right details into focus. Now, the fancy technical term for this lens switching is image weighting. By just tweaking the settings on the machine, the technologist can basically ask your body different questions. Like, hey, let's see all the fluid, and boom, they make it show up right. Or, show me the detailed anatomy, and they can make the fat stand out. It's this incredible flexibility that really makes MRIs such a powerhouse.
So you'll often hear these acronyms thrown around, T1, T2, and FLAIR. Think of them as the most popular lenses. A T1 image is great for anatomy because it makes fat look bright and clear. A T2 image does the opposite. It lights up water and fluid, which is perfect if you're looking for swelling or inflammation. And then there's FLAIR, which is this really clever one. It actually makes water dark, which is super useful for spotting things like MS lesions that might be hiding right next to the fluid in the brain.
But here's where it gets even cooler. MRI tech hasn't just been sitting around. It's moved way beyond taking still photos of your insides. Now it's doing something much more dynamic.
This is a huge leap forward. Seriously, we've gone from just asking, what does that organ look like, to asking, how is it actually working? And even, what's it made of chemically? I mean, that's a massive shift in what we can figure out without ever having to make a cut. And what can we do with this? The list is just mind-blowing. We can literally watch the heartbeat in real time. We can map out brain function as it's happening. We can check on things like silicone implants. We can even analyze the chemistry of a tumor. It's amazing stuff. One of the most exciting tools in this new toolbox is called spectroscopy. Just think of it like a virtual biopsy. Instead of just seeing the shape of a problem, it lets us see the actual molecules related to a disease. So we're not just seeing a lump. The machine can literally tell us about the chemicals inside that lump to help figure out what's going on. And this isn't just something for a science lab. This is being used in clinics right now. It helps doctors see if a brain tumor is shrinking after treatment, or they can track a disease like MS by looking at the actual metabolic changes happening deep inside the tissue. It's a real game changer for patient care. Okay, we've geeked out a lot on the technology, which is awesome, but let's bring it back down to earth. Let's talk about the human side of this. What's it actually like to get an MRI? It's a totally fair question, right? And let's be honest, the idea of going into that big machine can make anyone a little nervous. But just knowing what to expect can make all the difference and help you feel a lot more comfortable. First things first, and this is the most important part, safety. We have to remember an MRI is a giant, incredibly powerful magnet. So it is absolutely crucial, I can't stress this enough, that you tell your doctor and the tech if you have any metal in your body.
We're talking pacemakers, certain kinds of implants or clips, cochlear implants, even if you used to have a job where you might have gotten tiny metal fragments in your eyes. Being completely upfront about this is everything for your safety.
So on the day of your scan, what happens? It's a pretty straightforward process. It all kicks off with that detailed safety screening we just talked about. Sometimes you might need a little prep. Maybe you have to fast, or you might get a contrast agent through an IV. That just helps make the pictures even clearer. Then, you just lie down on a table that gently slides into the machine. Your biggest job, just to lie as still as you can. But don't worry, you can talk to the technologist the whole time, and when it's all done, you can pretty much just get up and go on with your day. No recovery time needed.
So what's the bottom line here? The crucial point is that MRI is just this incredibly powerful and, importantly, safe window into the human body. It's a marvel of technology that has totally transformed how doctors diagnose and treat disease.
Which really leaves us with a final kind of mind-bending question. I mean, MRI first showed us the body's structure. Now it's showing us how it works, its actual chemistry. So as this tech keeps getting better and better, you just have to wonder, what's it going to reveal next?